Dr Bruce Dooley, it's wonderful to have you here to talk about today perhaps steps forward for health. What could a new New Zealand health system look like? But I also want to discuss your contribution to New Zealand since you've been here since the late 90s. You regard yourself as an integrative medicine doctor. Mm-hmm. And I do want a disclaimer here to say you are not giving advice in this interview, not giving medical or health advice in any way. We're just more going to talk about your journey and perhaps a journey for New Zealand. Would that be fair? Anything you want to add to that?
No, I mean, I just think that integrative medicine needs to be understood for what it is, really, basically, because, there's a lot of people that really don't know. You've heard the terms holistic medicine. You've heard complementary and alternative medicine.
Natural health.
Natural health. And so it's a fusion, integrative medicine of the conventional medicine that I was trained in and the anatomy and the physiology, and that's all good. I mean, it's really important to have that. And even important to know pharmacology. Although I think it's way overdone, it's given way too much emphasis compared to no emphasis for the known natural healing things, and so I think that the physicians of the future and even the ones now would really do well to be able to get continuing medical education credits to fulfill their licensure with studies more in the natural area, so that they can become attuned to. Oftentimes, and this is really, they call it Dr. Google, I mean, the conventional trained, even young doctors, they get frustrated because patients come in armed with all this information about natural supplements. And what do you think about this? What do you think about this, doctor? And the doctor is at a loss many times. In the past, it used to be kind of the response was, well, we only deal with things that are scientifically based, and they blow it off. And I think the doctors who really care are understanding that this is a legitimate thing for patients to be asking. I think the days when the patient goes in, sits down, and says, expects a doctor to tell him or her exactly what to do without any kind of back and forth exchange, I think they're gone, I hope. I think the patients are more proactive and they want to be part of their healing plan. They want to not just be told what to do. Take these pills and go home. It still happens a lot. I hear it a lot. But I think that it's moving, and I think that shift is going to be faster if integrative docs like myself are able to get out from under the boot of a medical council that is saying that's misinformation, that's disinformation, and simply having an anonymous person, by the way. Many times these complaints that go to the medical boards none of them are lodged by patients, almost ever, never. I've never heard that, really. They're always lodged by another medical person. And then those people are allowed anonymity. So you don't even know who your accuser is. And that's just not a fair system, because literally, you could constantly be under attack, and of course the medical council says that they have to respond to all these complaints. So it's an endless cycle until we break the cycle and say, as long as the doctor, integrated doctor, CAM doctor, is not harming patients, truly harming patients, none of this other types of harm, I think then other doctors will be more interested in kind of like looking into it and maybe doing some studies.
When you mentioned this other types of harm in another interview that we've done, you've mentioned that they extended the definition of harm to be, in fact, totally nebulous, very hard to pin down, mm-hmm. wasn't it? They were talking about potential economic harm if you go to an alternative, trying to cast the net as wide as they can to bring in everybody to say, as we were told in the rollout of the COVID response, there's only one health way. And I think, as you say, there's a sea change happening where the patients like me are going, but I want hundreds of options. I think there are hundreds of different health options I could choose. And that's what integrative doctors offer, isn't it? Not necessarily hundreds each one, but you offer another part of that pie.
We do, and it's fun to see people, to do something. And first of all, it's very reassuring to us doctors that are using natural, non-toxic substances. It's very reassuring that we know that we can offer, say, this, for whatever that's natural, without any having adverse reactions or bad side effects. Which pharmaceuticals are the third leading cause of death in the world. Third leading cause of death.
Wow.
Mm-hmm. Yep.
Because of side effects.
Because of side effects. And I think there's no controversy about that. It goes back and forth between cardiac and cancer. They go back and forth between first and second place. But the overall negative side effects. And by the way, really interesting thing to note. If I prescribe for you a prescription drug, now that drug has been studied. It's gone through the phases. Unlike the inoculation, it's gone through all of these cycles of testing, thousands of people. And they generate from that testing all of these adverse reactions, which are there on my screen. I can go over them with people. But if I give you a second drug, on top of that drug has also been studied and has all its adverse reactions, right? But the two drugs themselves have never been studied together, what impact they would have on thousands of people. So I try to tell people that the minute that you take another drug, prescription drug, on top of this one, you really become your own experimental beaker. And I would have no idea what the synergistic cross-reactivity would be of those two drugs. No doctors do. We can't. There's no way to knowing. So, this weighs against, in my mind, it weighs against this seeming tendency to just add on more and more and more prescriptions. Some people taking 2, 3, 4, 5 prescriptions. And, what is that soup of chemicals going to be doing?
We only have to cast our minds back to school science labs and putting things into a beaker, as you say, and watching them explode together. And you think, what is going on? Something that really concerned me about the rollout of the COVID-19 material was there was also no testing of that in the body with the effect of drugs that people were already taking. I couldn't find any tests at all that had been carried out on that. Could you? No, and they would not be able to do that anyway, even if they tried. That's just too hard a study. I mean, everybody's on all these different drugs, and you wouldn't be able to try to test a vaccine against them. So the options. So I come to you and I say, look, I'm looking for something much broader than I've been getting from my doctor. I want someone open-minded. Mm-hmm. This is what I want. I want someone who can look at my particular body and say, for your balance, for a better homeostasis, better balance in your body, let's try a bit of this. Mm-hmm. And maybe you might need a drug for a short time, but I think this will get you more balanced. What kinds of things can you offer? What kinds of things are those products?
It's just, for instance, somebody recently told me that he knew a person who had, all of a sudden in her 60s, had high blood pressure and some mental changes, some forgetfulness, and so I said, well, how many amalgams are in her mouth? We have to check the idea that mercury is possibly behind this, and it turned out that she didn't have any amalgams in her mouth, but that she came from Japan and she ate tuna all the time. She had a can of tuna every day. And so I know, because tuna has a lot of mercury, and I know that mercury will raise your blood pressure, will create all kinds of toxic effects on the neurological system, cognitive system. And for years I had a company that worked with mercury detoxification. When you take an amalgam with mercury in it, you can get off venting all the time of mercury into the body.
And the effect of that? What is the effect on the neurology?
Anything neurological. I mean, we're talking about, first of all, cognitive issues, brain fogs, tremors.
Depression? Is
depression.
It
it's really, I gave a lecture once to psychologists Mostly psychologists. And I said, you know, probably that's number 2 or 3 on the list of 100 things that mercury can be behind. And the World Health Organization itself studied mercury because their job was to give profiles on any poison. So they considered mercury, which it is, a poison. And the interesting finding was, mercury was, that and this is their wording was, there is no known level of non-toxicity in mercury. Think about that for a second. There is no known level of non-toxicity. That meant that when they studied mercury down to the parts per million, they were still seeing mitochondrial changes and membrane changes. So literally, it's one of the few poisons that, you know, you just keep going down as far as you can and you still find changes. That's on the World WHO's site now for mercury still, I think.
If it's in your mouth as a filling, is it inert? Is it inert in that state?
No, it's not. And it's not. And there's I invite the audience to go into a biological dentistry organization's website. All you have to type in the search engine is smoking amalgam. And you'll see a 25-year-old tooth with a filling in it being held up against a special screen that shows mercury vapor coming off of it.
In 1991, the World Health Organization acknowledged that the predominant source of human exposure to mercury is from your fillings. That should be of concern to anyone. So all mercury silver fillings leak substantial amounts of mercury constantly. The amount increases with any kind of stimulation, and as a result, mercury from fillings produces the majority of human exposure to mercury. The International Academy of Oral Medicine and Toxicology is extremely concerned about the anecdotal claims of safety by manufacturers and dental trade associations that are at variance with the published peer-reviewed scientific evidence to the contrary. The precautionary principle requires action once the possibility of harm exists. It does not require proof beyond a shadow of a doubt that in the case of heavy metal and xenobiotic exposure is both nearly impossible and unnecessary, in our opinion. What you're seeing is mercury vapor coming off a 25-year-old silver amalgam filling in an extracted tooth. The background is a phosphorescent screen. The mercury vapor absorbs the fluorescent light, and you can see it as a shadow on the screen. This is mercury coming off a filling that was dipped in water that's the same temperature as the human body. This is a filling that was rubbed with a pencil eraser for just a few seconds. Like going to the hygienist and having her clean your teeth. These are not small amounts of mercury. If you can see it, it's more than 1,000 times higher than the Environmental Protection Agency will allow for the air that we breathe. What about the last time you went to the dentist and they drilled on your tooth? Here is the mercury vapor every time you raise the temperature to 110 degrees with hot coffee or warm water, or even chewed on it.
Wow, so for somebody with mercury fillings in their mouth right now, watching this,
Yeah,
what's your advice? It's stay calm at all points,
Stay calm.
isn't it?
Know that, you know, I'm not suggesting at all that people run and try to get the mercury. In fact, the truth is that there's very few dentists that are aware that they just can't drill out a filling because you get a massive millionfold increase in mercury vapor.
Because it releases so much into the bloodstream.
So you want to do it safely.
That.
And so at the point in time, do I insist that my patients get them out? No. I know there's some doctors that are very adamant about it. Yeah. However, if a person, I have to tell you that, you know, when people are really struggling against a disease like cancer, and they want to do anything and everything to make their immune system, because it's a very much of immune suppressant, big time, that I would say, well, you might want to consider that we safely get those out, you know?
Yes.
And
there are ways to do it with a sort of, I think they call it a trampoline or some kind of cover at the back of the mouth to capture as much as possible.
Yeah, dams, they call them dams.
Dams,
I think.
to do it as really carefully as possible. But otherwise, is chelation therapy something that can help reduce that mercury?
Yeah, chelation, I've done that for years. That's kind of known in the States for chelation therapy. Mm-hmm. And it's a, chelation, it comes from the word chel, claw. And it indicates the molecules that are specifically can bind to metals and lock onto them and take them out of the body. So in fact, if you get lead toxicity right now, Liz, say, I don't know how you would get lead toxicity, but suppose you got lead toxicity and you went to the emergency room, they would give you intravenous ethylene diamine tetraacetate, EDTA, because it's a lead chelator. So, and then there's other ones like DMPS for mercury, DMSA for mercury, and other ones that we use,
Have you seen great results with it?
Oh my gosh, yes.
In what ways?
In pretty much, whatever you're shooting for. I mean, the point is that people who are depressed, again, people who are having cardiac arrhythmias, many times skipping beats and things like that. We know, because the heart's an electrical organ, we know that the heart has a tenfold increase, concentrating increase in mercury in the heart. And so when you think about that, the heart is just one big nerve bundle, basically. So if you impregnate that with large amounts over time, like maybe this woman did with who had the tuna every day, then you're going to basically have some arrhythmia. So it's not. We've been able to get rid of arrhythmias with chelation therapy, and
that must be so satisfying. I need to pull you up on that fish comment. You said tuna is known for having mercury. Is that because it's a larger fish? So in the whole scale up of the food.
Yeah, it's called bioaccumulation.
Of the food chain, yes.
Yeah, going from plankton all the way up, and it just bioaccumulates. So
and that's
shark
because industry has put mercury around those waters.
Well, no, mercury is naturally occurring in water, actually. But that being said, one of the biggest producers of mercury in the world is coal-fired coal plants, and power plants with coal. Mm-hmm. Coal has an awful lot of high mercury content, so that goes in the atmosphere, falls into the ocean as one of the ways of mercury getting in there. Mm-hmm. Yeah.
Your whole approach as a doctor, as I talk to you, is such a beautiful overview you seem to begin with. You look at the bigger picture of what's going on, and then how can we focus in on ways that will really, really help this person. Why have we got so far away from that? We've gone from that old-fashioned doctoring, let's see what's going on in your life, let's hone in on something that can help your specific body, to a kind of standardized in-out 15 minutes, a few pills that I gave to
it's interesting that you say that, because it kind of takes me back to, yesterday we talked about the Federation coming around in 1913.
And we'll attach that interview underneath this.
Okay, all right. And prior to that, again, we had an awful lot of natural therapy being offered to people, which was, a lot of it was shut down by the Flexner Report and the schools that we talked about. And so
we're talking now around the beginning of the 1900s. Yeah. There were a lot of options.
And, truth being that the remaining allopathic schools they just basically never went there. They never went to that.
Excluded homeopathy, herbs.
Well, yeah, they basically.
Food, nutrition.
When I went to medical school, and I trained when I was 16-year-old, I trained with an 8th degree black belt Taekwondo Korean acupuncturist. He was a doctor of acupuncture too, and I saw things with acupuncture that were unbelievable. And when I was 16, that he was doing with these needles, it was like impossible. And so I get into medical school at Jefferson, and I clearly remember. I think it was the first year. I clearly remember this somebody raising their hand in the lecture hall and saying, what about acupuncture? And
which is 2,000 years old, by the way,
or
from
5,000, I think.
5,000. Wow.
Yeah. And I remember the professor that's just placebo. And I kind of outed myself, because I stood up and I said, no, I've seen, it's not placebo. And I kind of So I started then. I think I got into trouble or something. I'm not sure, but yeah. I mean, I just said no. I mean, don't tell me that something that's 5,000 years old persists for 5,000 years if it doesn't work.
Absolutely.
But by the way, that being said, placebo is really important.
Explain that.
Oh my God. There was I wrote a letter to the Broward Medical Association back when I was talking to conventional medicine, and. I wrote a letter and I said, the thing is, the problem here, because there was a lot of malpractice suing going on in Florida, still is. And so what's happened with this malpractice business is that, or here they call it medical, what do they call it? Misadventure?
Misadventure.
Medical
Yes.
misadventure.
Yes.
I love that.
Yeah.
That's just medical misadventure. So British.
It is. It's beautifully understated. Sounds like a bit of a
It's
game.
like, you screwed up. No.
Yeah.
Anyway,
Yeah.
so the point is that, and by that way, we have a word for that, iatrogenic, that we could use around the bedside when the patient wouldn't even know. The doctor could, the lead doctor could say, well, this turned out to be an iatrogenic event, you know.
And that means you screwed up?
Caused by the system. It means caused by
Whoa.
the treatment. Iatrogenic, yeah. Sorry, I just gave it away. That was supposed to be a secret. Not supposed to tell the public by iatrogenic. But of course, a lot of things are iatrogenic. But also, the letter I wrote to the Broward Medical Association said, because we're being sued so much, we have to be so careful that we can no longer just say, don't worry about it, take the stethoscope out with that old magic stethoscope, run around the chest here and back and tap the feet or whatever you do, and then you say, you know, Liz, you'll be fine, don't worry about it, it's just a little bubble in your stomach or something, you know, and you go, well, good. The point is that message is interrupted now by, well, we don't really know, we have to do another test. Well, that test is normal, but we have to do this, we have to do this. So there's always this kind of like uncertainty. There's no finality. And so that placebo effect, which, arguably sometimes can be like 50% effective, if you go study it, I'm not really sure about the numbers, but it's huge. Yeah. So we have ability with our own minds to be able to heal ourselves. And I think that's way overlooked. Not looked at all, I think, in most cases.
There's a huge field now of science opening up called the quantum field, which is exactly our thoughts create our reality, and that can be our bodies. And that's for people to research. A lot of this, you say yourself, people need to research their own material. I loved what you spoke about before, that I come into you as my doctor, but you and I are partners. Yeah. I've done my research, exactly. I have questions. You treat me with that respect. You don't talk down to me as an ignorant.
No, because my patients they're smart. I mean, and they come to me specifically because they want to be listened to, and they want to be offered options. Because many times they've gone and they've been told this is the only option. And so that's what's the fun part about it, is that we can do that. We can work together as a team, adjust course, make some course corrections. It's not like this is the first time, but you're getting better, you're getting more energy, your brain's getting clearer. A lot of what I do is the gut. I mean, right now, because of the diet, because of antibiotics, because of stress is another one. We are all walking around with really messed up microbiomes. And the microbiome, 70% of your immune system exists around your gut. 70%. It's called the gut-associated lymphoid tissue, GALT. So they're there. And when you start getting overgrowth of bad bugs that are replacing the good bugs, and these what we call microbiome, they activate this immune system, the GALT, and so a huge amount of the autoimmune diseases are coming from gut dysbiosis or imbalances in the gut. Leaky gut is another word we call it, and we're not taught any of this in medical school. Not at all. So we had to basically my integrative conferences over the years. I would say the last 10 years, 40% of the conferences focus on the gut.
Wow. And what kinds of things? I mean, we know about probiotics, but what at a much more nuanced level?
Yeah, what
kinds of things would you offer?
Well, the thing is that, there are so many things you can do to remove the bad guys, put in the good guys, help heal this inflammatory process that's in your gut wall. And cool it down. Like turmeric is a wonderful thing. Turmeric and curcumin, these are fish oils. So there's an awful lot of things out there that are really designed or been shown to be really helpful in repairing and getting the gut back in balance. So I do a lot of work, and I'm going to be doing this now by telemedicine too.
Explain that, because that's been a change that's come, that's a positive that's come out of the COVID-19 lockdowns, isn't it?
It's kind of interesting, and actually the patients are liking it, even though I'm not allowed to have direct contact with patients. They may be 2 or 3 kilometers away, but we'll do a Zoom, and I can share my screen with them, and we can talk, and spend the hour. Usually it's 45 minutes to an hour I spend. And they feel satisfied, you know, and we can ship them if there's products that can help them, I usually tell them to go online and buy it if it's available.
And just that alone, going from a 15-minute quick in and out at the surgery to having a doctor spend 45 minutes, that would have a massive placebo effect itself. He cares. He's interested in my health. That kind of feel.
It's so funny. I've had many patients who they come in, they don't know that I'm spending this much time. So basically, this is really interesting. I was taught, I went to an old medical school, and they taught me an awful lot of interesting things. And this one professor said, doctors to be, us, he says, here's the deal. He says, if you let a patient talk long enough, he or she will give you their diagnosis, if you just let them talk. But when they've done studies with people, patients have been, I think, something like they're given like 2 minutes, even that, before the doctor kicks in and starts talking. So what I do, and I've had some funny things, I just let the patients talk, and I'll just ask, like you're doing to me, ask them a couple questions, ask them this, go a little bit deeper, and the patients will be talking. And I've had many, many times I find that patients stop and say, can I keep talking? Am I taking up your time? I said, no, carry on.
That's brilliant.
It's like, no. They're like, wow, that's great.
It's the antithesis of what I'm getting in the interviews with the jab injured who say they go into the hospitals, they try to say, I know this is what's happened in my body. And the doctors are saying, no, it's not. You've just got anxiety. Dismiss them, reduce them, minimize them. And they often tell me they feel re-traumatized by not being heard. A doctor's power may partly be in the listening, mightn't it be?
I think it's a huge part of the power, which is basically that you're letting a person carry on with their symptoms and asking them a little bit more. And then, if it's something that there's a little blurb in something like, well, a person may say, well, my husband doesn't understand what I'm saying. I'll say, well, tell me about that. Tell what's your relationship with your husband? Is it stressful? And all of a sudden we've opened a different door, but that door is important. And that door is almost never talked about in the system, generally for most people. And all of a sudden there's a healing there, because all of a sudden that person can get it out about their marital situation being, or the partner's situation being a big stress in their life. Or how about sleep? I almost everybody gets a question. When do you go to sleep? Do you have no trouble getting to sleep? How many hours do you get? When you wake up, do you feel refreshed and ready to go? Or do you feel like, ugh? Well, these are all important things, because sleep deprivation now, with the stresses that are going on with people, it's just amazing. Yeah, we need that.
And then there's nutrition. You talked about curcumin and turmeric. On that note, do you know about the quality of the vitamins that we get in New Zealand? Do we get a good quality compared with the vast range I know are available in America? How would you rate the quality?
I've been disappointed in it, and but again, I'm not an expert. But I know that we had in the States, when at my clinics, I had a huge range of choices, and I knew the quality. I knew the owners of these major companies. They would come, instead of us having at our conventions, instead of us having pharmaceutical backing, we didn't know pharmaceuticals. They wouldn't come close to us with a 10-foot pole, but we were supported by the vitamin companies. They would set up booths, and they would, in a break, we would go and we'd learn about this testing center. We actually had functional testing. We have functional testing centers there with tremendous capacity, and we can still use them from here and ship things to the States for these functional labs.
It would be wonderful to have that. And when you're saying we, just do a reprise of that. You were a leading light in American integrative medicine. What was the group that you organized, and just a little bit about their history?
Well, it was called the American College for the Advancement of Medicine. ACAM. And now the leading one would be the Institute for Functional Medicine, which was started by my friend Dr. Jeff Bland. Wonderful man. He's the I think he's credited with coming up with the term functional medicine, which is We haven't introduced functional medicine here as a name because we don't get people too confused. We're staying with the integrative, but really in the States, it's moved into what we call functional medicine.
Are they the same?
Same
Yeah.
thing.
Yeah.
But we think that it's a better descriptor.
Yes.
That we're dealing with function and we're dealing with how to restore function, how to restore homeostasis. We talked about homeostasis yesterday. Bring balance to the body, because a balanced body again is like endless. And we have two ages. We have two ages. You have two ages.
Meaning?
Yeah. Well, we all know you're only 30 chronologically, so you have a chronological age, right?
Yeah.
But what's the other age we have?
An emotional.
Well, I can act like a child. That's an emotion. I should say, maybe that's one too. But it's a biological age.
Oh, right. Yes.
You're biological. What is your biological age? What is your chronological age? Right.
Yeah.
In integrative medicine, functional medicine, we'd like to see 20-year difference.
Wow.
We'd like to separate your chronological number. Well, I mean, maybe not when you're 12 or 15. That would be hard. But I mean, a person who comes to me.
Say a 60-year-old comes, they could be operating at a 40-year-old level.
Yeah.
Through what? Through good food, nutrition?
Through the detoxing systems and the things that we all talk about. I refer probably every patient, at least every patient, to an alternative practitioner that's in a specialty. So I embrace the chiropractors and the osteopaths and the colonic therapists and the homeopaths and the iridologists we have. And where I live, we have one that studied with she didn't study with Bernard Jensen, but she's got his book on his desk. And I just study, as you know. And so, we had a guy named Jack LaLanne. If everybody from Americans knows Jack LaLanne. Jack LaLanne was this guy who had his own TV show back in the 50s, 60s, 60s, 70s, right? And he would get in there and he would say, it was all about how you thought and what you ate and the exercise, right? And he was really famous, right? Jack LaLanne. And when Jack LaLanne was 70, on the 70th birthday, he towed 70 boats behind him in San Francisco Harbor with a person in each boat with his hands tied, handcuffed. He took him a mile around the San Francisco Harbor at 70. And at 80, he took 80 boats, each with a person in it, with his hands handcuffed, at 80.
The point of the handcuff? The point of the...
I guess just say I can do it with handcuffs. I mean, holy mackerel, just use both hands. I don't care, Jack, you're 80, He did it, and another mile. So this is a man who
had a very young biological age.
Yeah,
he was strong.
And he was trying to show. He says, it doesn't matter your age. It doesn't matter your chronological age. It really matters your biological age. So anyway, that's I guess it's been called anti-aging medicine. I don't kind of like it. It takes on a kind of a hokey feel, anti-aging, but really it is. I tell people I'm sitting here talking to them. I'm 85. They'll go.
But the question there is this languaging we have in the West that the body has to break down, they're getting older, of course they break down. That we don't have to make that assumption. We can be very fit and healthy through to the end.
I think it's really outrageous if a person goes to a doctor and says to the doctor, say a 70-year-old goes to a doctor, or say a 60-year-old. Goes to a doctor and says, I'm really tired. I'm kind of, and I've heard this before that the patient's told, well, you're 60.
That's crazy.
Well, it's like no, that's not the answer. The answer is maybe there is no answer, but the answer is let's just take a look at the other factors But you have to be trained in those other factors to ask the questions, and that's the thing. So the medicine of the future, in my opinion, this is what you're asking, and we're actually working on it right now where I live. Is to merge the different professionals together so that they all can have their own particular expertise put into that patient's situation, so that the medical doctor, if he or she hasn't been trained in it, at least now is supported by other people that are in nutrition, in gut issues and stuff like that.
And in detoxing. For that to happen, Dr. Bruce, we're going to have a real sea change in the way our medical students and the doctors who graduate are thinking, they're going to have to come out much more open-minded. Does that mean we have to get that kind of training into medical schools?
Boy, sure does. I mean, here's the situation. I'm going to tell you this is a true story. I went down to a cafe where we live one night, and I ran into a very wonderful 25-year-old woman. And we started talking, and she goes, I said, I was working with Tim Uher over. She says, I work with Tim. I said, you work with Tim? She says, yeah. She says, I was a doctor, but I quit because my first year as registrar, I couldn't handle the hospital scene anymore. And but she was coming to our conferences, and she was learning as a medical student. And we had a lot of medical students come to our holistic conferences, if you want to call them that, in Auckland.
Wow.
But how about she deregistered herself?
She was seeing that it was too narrow. It just
she just
did
said,
not
I just can't. She says, I knowing what I know now from coming to your conferences, and the system over here doesn't address any of that. And she says, and she deregistered herself, and I just thought, oh my God, it really tore my heart apart, because she'd worked
She'd worked so hard
to get there.
It's so incredible, though, isn't it, that that people are waking up to it from a world where when I was younger, doctors simply dismissed it. And even then, I thought their dismissal outright. I had friends who dismissed nutrition as a major cause of health. They said, "Oh, that's rubbish, Liz. No, it's you're not speaking medically at all." I knew this 20 years ago. I knew that nutrition was a key, but it's so incredible the way they are only just coming to it now. It's been such a denuded system. The medical system.
I had a story, and I won't get myself into trouble because I won't name any names, right? But I actually was kind of follow. I was given a week at a nearby hospital, medical clinic, conventional, that was an orientation week. And so I was going around with the different doctors, one doctor one day, one doctor. I was sitting there listening to patients, and this one fella came in, and he, and of course they didn't know who I was or what I was doing. I was just a guy. And so this doctor that I was with was looking at this patient's results of what was it? Liver functions had been elevated, and all of a sudden now they're down to normal. And this doctor, I'm not going to give the gender either. That's another topic for another day. But this doctor said, "Well, what have you done, Harry? I don't understand what happened." He says, I'm taking this," and he pulled his phone out, and he was taking silymarin for liver, which is silymarin is a herb. It's a root, I think, or a seed. And I looked at it and I didn't say anything. And this doctor said, "Well, we only deal with things that are scientifically proven."
That arrogance. That's what I'm talking about.
So I went home that night and I thought, okay, well, so I went on to Google Scholar, and there's hundreds of studies on silymarin and liver function improvement. So I took 3 reviews. That is, reviews really takes a whole bunch of them. And, so I sent this doctor 3 of these links to 3 reviews.
Reputable scientific reviews.
Yeah.
Properly tested.
Oh, yeah, from, peer reviewed. And apparently this doctor got really mad at me. Got mad at me for kind of trying to educate this doctor. How about that? And I thought, wow, that's just something. That there's that, what is it that are the blinkers on too tight that you can't open them up? What's wrong with opening your aperture just a little bit and looking at the potential that there's a natural product that can actually lower liver function, and natural products that can do lots of different things,
If our medical schools are captured by one way only, which is the pharmaceutical way, at the moment they are, it's going to take the people, like me, I'm the client, I'm the patient for the doctor. It's going to take hundreds, thousands of us to say to our doctors, I want you to be more open-minded. I want you to look at more things.
Well, no, yesterday you read Eisenberg's initial study from the Harvard one that showed that billions of dollars were people were voting with their money. They were going to the doctors and spending it on alternative medicine. Remember, we read that. And that's really the alarm that went up back in the late 90s, which, of course, we were the preeminent medical group in the world, ACAM. There was nobody that had 1,200 members, and we're growing like we were growing. So then they
tried to crush you. They tried to crush you because they saw the money.
We were effectively crushed.
Yeah.
And yes, and so that movement was truncated and stopped pretty much. At least we were leading. It's now Institute for Functional Medicine. They've actually got a clinic in Cleveland Clinic. Cleveland Clinic is a very conventional. Well, now the Cleveland Clinic, I guess for about 8 years now, has a functional medicine department. So and they're growing like crazy. They started with 1 doctor and they're up to 8 doctors now.
Wow. In
the Cleveland Clinic. So it's changing, but boy, it's a slow thing, particularly in medicine, and particularly, as we talked about yesterday, particularly when there's some adversarial parts to this, that number one is, or the main one right now that I'm focused on is we need to be able to talk. We need to be able to feel safe, talk to other doctors, tell them what we're doing, talk to the patients without feeling that there's this sword of Damocles over our head called the medical council, which can come in and for almost nebulous reasons take away your license to practice
It's medicine. The medical council and the media, because they come in and talk about anything other than mainstream medicine, pharmaceutical medicine, as woo-woo stuff. And they're also very close-minded and not researching enough. So I think, again, it's going to be the people battling for this space, saying, I want more issues, with more options with my health. Yeah. I don't want just one way. In terms of the New Zealand that you could see, let's take this little country. So you were briefly alluding to the vitamin quality here could be better. Can I order vitamins through your clinic if I want to, the ones that you have?
Actually, I try to, as much as I can, to get people to, get them online or whatever. But I do keep in my clinic, I do keep physician-only brands that are very high-end, and I actually, in one of the brands, I actually know the owner, and he was actually lectured at he gave a talk to doctors at my clinic in Palm Beach. But for the most part, things are available that I think are high quality, and that's what I can do online too. I actually will pull up a site and I'll say you should get this coenzyme Q10, or you should get this MSM or whatever.
Does that work well? The phone consultation?
It's wonderful. People love it, and I quite frankly I could be wearing this and have my pajamas on.
like the old archetypal newsreader. But can you say that you are getting good results physically? That people's physical health is really going up?
Yeah. The point is that there are things that obviously you can't do by Zoom, and in that particular case, if they're local and I was permitted to see them, direct contact, then they would say, no, you need to come in. But for the people who are distant, and I'm uncomfortable, like if they say, look, I got this pain in my stomach here, I say, look, you need to have a doctor, and I just lost the time. You need to go to your doctor or go to the urgent care center in your area and have that checked. And maybe they need to do a blood test and make sure that's not appendicitis or something else,
You said you were at one of the oldest medical schools, Jefferson, in America. And you said to me yesterday, you absolutely love medicine, but you can see where it can be taken. What has been the most satisfying moment of your medical career, if I had to pin you down on one patient, one case where you just, I'm sure there are many, but is there that one?
There's so many, particularly with chelation therapy. I actually had my urgent care center in Fort Lauderdale, and this guy, John, came in, and he said his life was saved by this EDTA chelation therapy. And I thought, oh, what a bunch of baloney, you know. God, and he said, no, I was on death's door, and I did it, and now I can. So, but luckily, I had a bookshop next to me in the mall that I was in. So I went to the bookshop, and I got Elmer Cranton's book, who's a Harvard-trained doctor, MD. It's called Bypassing the Bypass. And it was a book about his 20 years in West Virginia, in the mountains of West Virginia, using chelation and all the results he was getting, right? So that's, finally I said, well, geez, I mean, okay, so I'm getting a hint here. So I put a couple chairs in, and I slowly, quietly did this, you know, quackery, and I was like, whoa. So one of my first patients, let's love this one. And his name
because
was,
it's a drip, isn't it? The
yeah,
chelation drip.
It's
an IV drip.
So, gosh, so we had this Mr. Gottlieb. He was about 80 years old, and he was totally deaf. He had a big box on his chest, a listening thing, and he had headphones on. That's how he listened. So he got through about 10 chelations in the back room, and I went in. I remember, like, the 10th chelation, I do another blood test. So I went into him, and I said, he had his headset off, and I'm like, oh man. So I go, Mr. Gottlieb. He goes, oh. I said, he just don't yell so loud. I said, Mr. Gottlieb. He goes, yes. I said, you can hear me? I said, yes. I'm like, oh. And just then the phone rang, and it was his daughter calling from Hawaii with her chiropractor husband, who had sent him in for chelation. And she goes, I got to tell you something. And I said, no, I got to tell you something. He said, no, I got to tell you something. I said, what? My dad can hear. I said, I know. I just tried. And to this day, I think what happened is he had, you know, the little bones in the middle ear, inner ear, they get fused by pathologic calcium. And so I think because chelation therapy, the function is to remove pathologic calcium, we talked about that earlier, and open up arteries and things like that, or make them more flexible anyway. But in his particular case, and he was the only one, by the way, but that's, you asked, that these little miracles happened, and that was a miracle to me.
Beautiful. So could it help people with tinnitus?
No,
have you?
I have tinnitus from a thing. It depends on the tinnitus, you know. It really does. But I've had, you know, we've had not really good luck with chelation and tinnitus. It's a tough one, tinnitus. Some people say it's angels whispering in your ear. I keep saying, well, what is that? What are you saying?
Let's explain briefly pathologic calcium, because if we're going to use a term, let's just leave people knowing at least a little bit about it. Can you just explain?
Well, I mean, we you know, a lot of people think calcium is good, and you know, and calcium is good. Okay, so in many ways, but you know, one of the top teachers of the 18th century or 19th century was Sir William Osler, O-S-L-E-R. And one of his things that Osler said was, wherever calcium goes, death follows. And he knew that when he was cutting into cadavers, he was hearing he was hitting grit, like, you know, in the shop.
Like gristle, sort of.
Yeah, he was hearing, you know,
yeah.
and it was that the tissues had become impregnated with calcium.
That's that word, calcified.
Calcified.
Right.
Yeah. And that's what hardening of the arteries is.
They stiffen up.
Yeah. What do you think, you know, when we say hardening of the arteries, that's a lack of compliance. It's kind of this end result of free radical on your body is that the cells turn into pathologic dust, if you will, calcium. So you get calcium in joints, and we call it something, osteoarthritis. You get calcium buildup in the eyes, we call it cataracts. You know, so pathologic or metastatic is another word. I don't like that because it has cancer overtones, but pathologic calcium is behind a lot of aging with people.
This is that difference of chronological and biological age. Keep yourself young by detoxing as well. Okay, so onwards to the New Zealand. I put you in charge of the Ministry of Health. You have the health portfolio for the next term, Dr. Bruce.
Yeah.
Where would you begin? How would you change it? What would you say to the country? We can have. This is my vision.
You mean in the one day in office before I get assassinated?
you set out your vision, and New Zealanders cheer and clap. What would that vision be? What would you say?
Unencumbered, that would be just fantastic. First of all, I would say, number one, pharmacists should be allowed to dispense the high-dose vitamin D that's currently available in pharmacies, stocked by the government. Everybody that came to see me when I was doing GP, I just assumed, because of my testing, that their vitamin D was low and put them on a supplement that's available as a prescription. Now, the pharmacist is allowed, by their scope, they're allowed to dispense, I don't know if you know this, but they're allowed to treat a urinary tract infection without you seeing a doctor. Okay, they can, as I understand it, and maybe I'm wrong, but they can actually say they can give you an antibiotic for that urinary tract infection. But they're not allowed to give you vitamin D, the high dose vitamin D, 50,000 IU. Yeah, isn't that interesting? So in order for you to get a good, strong dose of vitamin D, 50,000, you have to go to a doctor. And I've had lots of patients who heard my talks about how important vitamin D is. They go to their doctor, and the doctor says, well, we have to do a blood test before. And the blood test, interestingly enough, costs $60. You can do all these other blood tests in New Zealand that the government funds, but if you want a vitamin D level, $60 out of your pocket. And yet all the studies show how safe vitamin D is. There was one study of a guy that took 50,000 IUs a day for a year, and he had no changes in his blood testing, no changes in his health. I mean, actually positive changes in his health. But he took 50,000. Now that's anecdotal, I'm telling you, but it's certainly not 1,000 IUs a day is not going to get your blood level, your body tissue level up to the what we call the optimal range. And so I don't feel that it's critical for a person who's having all these other issues for me to say without a blood testing, yeah, this puts you on some vitamin D. Let's get your doses of vitamin D up.
What is the magic of vitamin D? I hear it everywhere now. Everyone's talking about it in this COVID rollout.
Actually, there was a Dr. Cohen in Israel who, he sounded like me when he was talking on this video I saw. He put all of his patients on, and he suggested that they take an average of 5,000 a day, 5,000 IU. He had 1,000 patients, he said, or 1,200, who got COVID, Delta COVID, right? Not one had to go to the hospital. 1,200. Now, don't you think that there was really no, I mean, I think it's talked about lifestyle and everything, but the functionally, because see, vitamin D it's involved in about 20,000 reactions. Almost every tissue in your body has receptors for vitamin D. So we in functional medicine don't even consider it a vitamin. It's a hormone. We consider vitamin D to be a hormone. And you can check that online. It's really literally a hormone. And in order to get high enough levels in the sun, as I understand it, you have to be like a half an hour in the good sun, nude, with maybe just panties on or something, for every day. Well, nobody's going to do that. Who's going to do that?
And we've had such a rainy, wet winter.
Yeah.
So even in summer, when people go, oh, you'll get it from the sun, it's still wise to take it.
And you want to know something as a journalist?
What?
When this whole COVID thing started back 2021, early, there was a New Zealand Herald writer, the medical writer for the New Zealand Herald. I don't know the name. It's a man, I think. And I saw that in November of, I think, 2019, he had run a story on the low vitamin D levels in Kiwi kids. So I thought, oh, here's a guy that will listen to my story. And I wrote him a letter saying, you should write an article on high-dose vitamin D for the population, and I gave him some links to studies. He never wrote back to me.
Gosh.
Well, now I thought, what is that? Here's a doctor saying, hey, you wrote the story on kids and low-dose vitamin D, and I'm trying to, and you don't even have the courtesy to write back to me? That's weird. That's really weird.
Very strange.
And,
Having done an earlier article acknowledging.
Yeah. And so if the Kiwi kids are low in vitamin D, why couldn't you turn your mind to the idea that a vast, large part of the population may be suboptimal, running around with suboptimal vitamin D. And why, that's another story in itself, but why are the sales of vitamin D restricted, or the dosaging kept to 1,000 IU? In the States, you can get 5,000, 10,000, you can get 20,000 over the counter. You can buy these kinds of dosaging of things, which are more appropriate.
Can you overdose? Can you overdose? Are there dangers?
As I told you, that there is just really so safe, and we have lots. There's really not. I mean, if I can only tell you that if you tried to find evidence on Google Scholar, of vitamin D overdose, I think you would be hardly any.
Let's mention that. Google Scholar is a site you've mentioned in an earlier interview we did. Just say a little bit about it here, because the way the media writes, they dismiss anybody who's found their information online, which is so errant. It's so arrogant to say that. There's a lot of good quality stuff.
There is, but there's also a lot of junk.
There's a lot of
online.
junk, and there's a lot of good quality if you search.
So in order to just expedite things for me, what I've done is, what I only do really at this point in time, is I actually go straight to Scholar. And if you just type in Scholar to any search engine, it'll go to Google Scholar, and then everything that's in there is most everything is a peer-reviewed journal.
Fantastic.
And so it's beautiful. I mean, it's really unbelievable. And though you can back up your statements to other doctors, by the way, which I do quite a lot, if they inquire why what's the deal with high dose vitamin C or D or coenzyme Q10, all these things that have massive studies behind them that should not be ignored.
Coenzyme Q10, just briefly.
CoQ10.
Yes, what is that good for?
Well, Japanese did a ton of study on CoQ10 back in the 70s, showing that it was very effective for cardiovascular disease, particularly high blood pressure, and so for energy too, because coenzyme CoQ10 feeds the mitochondria energy system. So and is found mostly in red meat. So there's a lot of people who are not eating red meat. And begin to feel de-energized. And many times I'll just say, well, try some CoQ10. And they'll write back and they'll say, wow, after a couple of weeks. And none of this stuff is instantaneous, don't get me wrong. It's not like, taking an aspirin and your headache goes away or something. It's kind of like, builds. And so I tell them, don't give this a couple of weeks. And yeah.
Okay, so you're the Minister of Health. You've got us all on vitamin D.
Yep, that's it. Everybody on D. No, actually, give the pharmacist the option to just dispense it.
Nice.
And then,
nice.
and without...
And in higher doses, too.
In the 50,000 that is available.
If I were Minister of Health, I'd want studies done on these sorts of things, IV vitamin C, on chelation therapy, on vitamin D, to prove the naysayers wrong, to say, in this study group, look at the improvement in health.
Yeah.
That would be wonderful. What else would you do if you were Minister of Health? For this little country of 5 million, how could we turn around what's been a devastating ride into rampant ill health? Many people are noticing their friends and family are much sicker, say, this winter than they have been in previous winters. How would you turn it around?
Well, I mean, first of all, we have to really get back to the basics. That is, people need to be aware that what they put in their mouth affects their health, and how they eat, and how they sleep, and all of these things that should be, I think, there should be, given equal time on the television and radio. Let's just get the government behind proactive preventive. Yeah. I mean, what's wrong with preventing stuff? I here in a quote unquote socialized medical system, you would think that they would really be into preventative. They would really be into it, and yet. Again, the training is not there. I would say that, I would, if I was Minister of Health, I would certainly say, give incentives for doctors to have wellness-backed type of practices, I would certainly give doctors more time, if that's possible. My gosh, doctors who really want to help, and I believe that doctors really want to help. But when they're put to the stresses of the computer saying that the next patient's already backed up, 45 minutes in the waiting room, and you've got a patient here who, has got an interesting story, but the clock is going, and and you're typing on the computer. It's a very stressful atmosphere for the doctor, and I just think it's unfair. I think it's unfair, and I think that the patients are frustrated, the doctors are frustrated, the nurses are frustrated. Everybody's frustrated right now in medicine,
What's the best way for people who would like a consultation with you to contact you?
So I have a website, drdooley.co.nz, drdooley.co.nz, and it has a description of functional medicine. It has you can schedule, book an appointment online, and I give myself a break, though. I give myself a day or two off because at this point in time but I really want to help people, but I also want to, since I've now become, I know a lot of the other doctors that think like me around the country. I really want to tip my hat to New Zealand's doctors speaking on science, New Zealand Doctors SOS, because they really care. They really want to keep this flame alive, that is particularly the flame of doctors being able to speak what they feel, and say what they feel. So, yeah, but I'd be happy. I'd love to see people, and I love dealing with people all around the country.
I love to finish on that, and we'll do that in a moment. That flame. But before that, you have mentioned a lot of really good books in the time I've been talking to you, researching these interviews with you. What are some of your outstanding books you'd recommend people to read that have really impacted you? Just for people's minds to open up to other possibilities. Could you name a couple of those books?
Gosh, yeah. That's interesting. If you're interested in finding out how powerful the mind is, Dr. Bernie Siegel wrote a book called Love, Medicine, and Miracles. And his story was amazing. Did you know the story?
No, I don't.
Oh my God, Bernie Siegel is this tough. He's still alive. He's this tough thoracic surgeon, bald, and he, like surgeons, he would, bully his way around. But the surgeons are unbelievable. And so one day he's in the supermarket, right? And I think her name was Alice. And he sees at the vegetable, he says, "Alice?" And she goes, "Dr. Siegel?" He says, "Alice, you're alive?" And she goes, "Yes, I am, Dr. Siegel." He said, "You had terminal cancer 2 years ago. I sent you home to die." She goes, "Yeah, I know." He says, "Well, what happened?" She said, "I didn't believe you."
That's brilliant.
So he went, "What?" So he went back, Bernie Siegel went back with his staff, and they went through all the files, and they found terminal people that, and he found a whole bunch of them are still alive years later, and he called them the exceptional cancer patients, ECAPs. And so he quit medicine, he quit surgery, and he began to realize that all these people had one thing in common, that they just I'm not going to buy into it. I'm not going to believe you.
They didn't give their power away.
They didn't give their power away. And so the worst thing, and in Russia, my wife is Russian, in Russia it is forbidden for a cancer, if you're a doctor and you have a patient with cancer, it's forbidden for you to tell the patient that he has cancer, actually, number one, and certainly forbidden to say you've only got 6 months to live. That will lose your license in Russia.
Because they know the power of suggestion.
Yeah, Russia's way ahead of us many times in the mind-body. And so the doctors absolutely, it's verboten I don't know very much Russian, but it is forbidden for a doctor to put that thought into a person's mind that you've only got 6 months. What is it? Get your affairs in order.
That's extraordinary. What was the name of the book? What was the
Love,
name?
Medicine, and Miracles.
Brilliant. And you mentioned Dr. Jensen before, whom you've trained with.
Yeah.
He's extraordinary on gut health. For me, his books are amazing.
Yeah.
Anything else that you would recommend?
Oh, well, again, my mind goes to people like Louise Hay, who wrote a book about how, emotions are involved with cancer and how you can do affirmations that you can. She has affirmations, and she had a whole center, in California, Louise Hay Center.
And for people who poo-poo that, disease has within it the two parts, dis-ease, not at ease. And if one's at ease in one's thoughts, Is there an argument to say one will be much healthier in
Oh,
one's
and it's
body?
easy to poo-poo it. When I was getting my master's in Villanova, there was a doctor at the end of the hall. It was called the Office of Department of Psychoneuroimmunology, which means somehow the brain affects the nervous system and immune system, right? And we said, oh, he's so full of baloney, right? There's 20 journals a month now on how the mind affects the body. 20 journals are published a month on the way the brain and the immune system and the nervous system all work together. So do I think things like meditation are important, or like Qigong or Tai Chi, where people can cool down the nervous systems and get out of the craziness that the world's become? The best thing you can do for your health?
What?
Turn off the TV.
Yeah, that's so true.
Just turn that off.
Turn off the mainstream.
Because it's sending you a lot of fear. It's sending you a lot of distress.
A lot of
and
lies.
It's going in.
A lot of lies.
Well, I don't know about those lies because I haven't had a TV for 16 years. My daughter, who's 12 years old, has never seen TV except when we go to a hotel room. She's like, Dad, that's the stupidest thing. That's called a commercial. I said, yeah, that's really pretty stupid. Yeah, that's it. Her mind's like, why are they laughing and everything like that? It's just not funny, or whatever.
She can see how false it is.
And interestingly enough, all she gets to see is Soviet movies from the 40s, 50s, and 60s. And she knows Russian, so she can understand. But interesting, all the cartoons that she was raised on were Russian cartoons. And the same with the movies. There's no violence.
In Russia?
Violence in the movies. Very little. Gratuitous violence? Niet. They do not allow it. And this was, of course, funded by the Communist Party back then, all of these movies. And many times these movies actually had very anti-government messages in it that were allowed to go through, which I was shocked. It's like, wow, the communist government's paying for this? This is behind the Iron Curtain, But I've learned a lot about, and appreciate the mindset that is, you're not going to put violence into the minds of our kids in the cartoons at all. No slapping, no whacking, none of that stuff. Like, nope. And the other thing that I thought was really interesting about the Russian system, you got me into the Russian system, is that they still give newborn mothers who just had babies, a year of free kefir.
That's
everybody.
The fermented
milk.
Full of probiotics.
Full of probiotics. They give it to all mothers free of charge in Russia to this day, as I understand. And so that's what they're promoting is a healthy gut bugs, breastfeeding the baby. The baby gets the benefits of that too.
Imagine having some honourable people. If, as Minister of Health, you get teams of Kiwis, honourable ones who aren't ripping off the system, going out to all these countries, finding the best health ideas. Well, the whole thrust of this discussion is that there is so much richness we can tap into that we're not tapping into at the moment. But it wouldn't be hard, would it, to turn the system around?
This country, particularly where I live, is just chock-a with healthcare practitioners of many sizes and shapes and colors, and they're all wanting to be heard. They're all working on their own little things, or maybe a few of them together. But they need to be acknowledged that they have something to offer to this healthcare system. If not in actual dollars being given to them, which maybe I would stay away from. We had to talk about who controls you if they pay you, but at least acknowledge them in the media and not talk about them being fringe and all these other negative words that are being cast upon them.
Nurture it, and this flowering, this sort of renaissance, this rebirth in New Zealand. What I'd love to do, Dr. Bruce Dooley, is over the coming months just talk to you semi-regularly, if you're open to this, about different aspects you're dealing with in your health practice, and even if they're short little vignettes. Yeah, I'd love that as an ongoing series.
And come on down and visit me.
I'd love to do that. Thank you so much, Dr. Bruce Dooley.
My pleasure. My pleasure. Thank you, Liz.